so glad that you've chosen to spend your Sunday afternoon with us. I'm going to move right into introducing Kate. Dr. Kate MacAdam is a sports chiropractor specialist and a mental performance consultant. She has dedicated her career to giving back to her profession and her community through her commitment to patient care, academia, teaching, research, mentoring, and volunteering. Dr. MacAdam has a passion for advocacy and policy in chiropractic. She is currently a board member for the Canadian Chiropractic Research Foundation. She also serves as an opinion leader for the Canadian Chiropractic Guidelines Initiative. She had the privilege to serve as the chair of the Canadian Chiropractic Association Patient Experience Task Force. And provincially, she serves as both the vice president and treasurer of the Council of Nova Scotia College of Chiropractors. And we are delighted that she is able to join us today and share a bit on this topic. So Kate, we're very happy to have you, and I'm going to turn it over to you.
Thank you so much for the warm introduction and welcome. It's an honor and privilege to join you all today on this beautiful Sunday and beautiful long weekend. And I'm really excited today to go over a few things that we do here in our clinic and that I do specifically that might help you use some of the things that we use in our clinic to help as an adjunct to what you currently do use already to help you with a lot of your pain. So when it comes to scleroderma, some of the things that we like to help you with are issues pertaining to some of the symptoms that you currently go through, particularly when it comes to joint pain, musculoskeletal pain, issues with bowel and bladder and reflux, Raynaud's, some of the thickening and tightening of your skin, and a little bit of the dilation into your fingers as well. So we are adding some really neat tips today in order to help give you a few more options of what we can do for you if you come to us in any of our clinics. So many patients with autoimmune diseases, or what we used to typically call chronic pain, which we now call persistent pain, they can add some manual therapy to their medical intervention. So some of the things that we offer here in our clinic are manual therapies such as acupuncture and traditional Chinese medicine, massage therapy, chiropractic, and mind-body therapy. So this afternoon, I'm going to take you through some of these topics, and we're also going to do a little tiny demo with each one of them today and provide you with a few things that you can do for home in terms of, and help you with your home care as well. So those four professions and those four modalities and those four issues that we just mentioned, the question is, well, Kate, why would you add those to your clinic? So what is it about those modalities that people would come to see you for? How do they work? Well, about 25 years ago when I was in school, we didn't know how they worked. We learned about 20 to 25 different theories of how manual therapy was effective in the clinic. And over the course of time, we're getting more and more specific, and research is being done on how the therapeutic visit that you get in our offices is helping you with your pain. So now what we know is that a few things occur when you're in our treatment rooms. We know that any type of effective touch, so any touch mediates the release of neurochemicals. When you're touched, we stimulate what we call mechanoreceptors on the skin. And a mechanoreceptor is a receptor on the skin. When it's stimulated, it sends a message to the brain, and the brain interprets how it's going to interpret it. If the sensation feels like pain, it'll send a message back down to the tissue in order to get away from the pain as fast as possible. If it's interpreted as pressure, the brain will send the message back down for the tissue to relax. And that is what we're trying to achieve when we do effective touch. The other receptor on our skin is a thermoreceptor, and that one only detects heat. And that's how we can come off of a hot stimulus very, very quickly without burning our skin. So when we touch you, or when you're touched in a therapeutic way, this results by reducing the physiological and behavioral activity to stressors and improves your mood and effect. And that's why we don't get quite the same effect when we massage ourselves or we provide traction or we provide any sort of stimulus to our tissue. Feels good, but not the same way as it would if you see a manual therapist. The other thing that happens in manual therapy is we have a change in our contextual factors. What that means is that when you have a positive therapeutic encounter that is tied to clinical outcomes, in other words, when we help you with the symptoms or signs that you come in with, the magnitude of the response is influenced by your mood, expectation, and conditioning. Okay, so if you come into our office and you have a great experience, that's going to help you with your clinical outcome, and it's going to give you the hope and the faith that your pain or your symptom or your sign has been improved. The other thing that happens where most of the research is occurring now is in the mechanical factors. What we know is when we stimulate or stretch the neurovascular structures and muscles, it induces a molecular response that helps diminish intraneural edema and expedite the clearance of noxious biochemical byproducts. Now that was a mouthful and quite the sentence. But what's happening is when we have manual therapy and we stretch or stimulate that tissue, it helps to get rid of pain on your nervous system, so your nerves, and helps to flush out any noxious stimulus or any toxins in the system. The other thing that happens has to do with neurological factors. So when we stimulate nerves or somatosensory nerves, it inhibits the nociceptive, which is pain processing, and activates the descending inhibitory mechanisms. What does that mean? It means that it influences the neuroimmune process correlated with the experience of pain. Another mouthful. Let's put that in English. When we stimulate a painful area of the tissue, it helps, as the message goes from the tissue to the brain, it sends a message of relaxation back into the tissue, which helps your pain levels. We're going to talk a little bit about acupuncture now. Acupuncture helps to stimulate our central nervous system. Our central nervous system is our brain and our spinal cord. And when we do acupuncture, it will release chemicals into the muscles, the spinal cord, and the brain. And these changes may stimulate the body's natural healing abilities and promote physical and emotional well-being. We have a few studies as well that suggest that acupuncture may improve blood flow in the hands and fingers, which would help with Raynaud's and capillary distribution, help with fingertip ulcers, and reduce the formation of fibrous tissue, as well as with pain. Traditional Chinese medicine, including acupuncture, has been around for over 2,500 years. Acupuncturists see the body as a system of energy pathways. We believe that we have 14 meridians or energy channels running through the body. Those 14 meridians are associated with an organ. And along those meridians, there are 361 acupuncture points. We believe that pain and illness happen when energy or qi is interrupted anywhere along the meridians. So we use needles to stimulate points along the meridians in order to help with pain and to stimulate the balance and flow that restores health again. So with acupuncture, we have different sizes of needles that we use. This one here is a 3-inch needle, And a needle comes in a little plastic tube with a little tip. I'm going to show you a demo with a little tiny one. So they come in little blister packs. So how we insert is we take the little tab off of the plastic tube, and you can see how this needle is very, very tiny, okay? It's not much bigger than my thumb. So I put it back in the plastic tube. Let's say I'm going to do my thumb. So I find the area that I'm going to use on the acupuncture point or meridian, and I just tap it in, and it's as simple as that, okay? So that's acupuncture 101, very effective. So I'm not going into the muscle or the nerve or the ligament or the bone, just right into that little acupuncture point, and then you just take it right out, okay? There's no pain involved with acupuncture at all because we're not stimulating a tissue that creates a sharp pain. So let's say we don't have access to acupuncture needles. One of the things that we can do instead at home is we can use acupressure. And this technique is very similar to acupuncture, but it uses our fingertip instead of the pressure of the needles. And acupuncture actually grew out of acupressure. And the pressure of our fingertips on tender areas can alleviate pain. It's a safe technique, and we can do it at home and teach ourselves. Sometimes with patients with scleroderma, though, they're going to have some difficulty putting pressure on their fingertips to provide that beautiful acupressure relief. So sometimes you can rely on the help of your caregiver or others, or use an assistive device in order to achieve that as well. So when you have scleroderma, some of the meridians that we want to help with would be the spleen. We want to move some of the stagnation through the liver. We want to tonify the liver as well as the kidney. And this is what we call the base pattern. So what we're going to do now is a small demo showing you some acupressure points that you can do at home. I think there's 5 of them. So the first one that we're going to show you is called spleen 6. And spleen 6 is a very, very powerful acupressure point. And it's going to help you with any of your pelvic disorders, anything with your kidneys or your bladder or your urinary system. It helps with insomnia. So if you have challenging time sleeping through the night, it helps with any gynecological issues too, including cramping. Spleen 6 also helps with red, inflamed, and irritated skin. And it also will help you if you're having any emotional conditions, including anxiety. Okay, it's a really strong point to help you relax. So in order to find it, we look on the inside of our ankle and we go to the area of the ankle where the little ankle bone is. And this is called the medial malleolus. So as you trace your finger up, we're going to use 4 finger widths, okay? Right above the inside of the ankle, and you'll find a small depression on the inside of your ankle, about 4 finger widths up. And it's going to be very, very sensitive when you feel it. Okay. I'm going to bring my foot up so that you can see from a demo, my socks off in advance. 4 finger widths. Right in here, there's a very tender depression right here, and that's called spleen 6. So you can massage it yourself for 4 to 5 seconds. You can hold the pressure point, okay? Or you can sort of stroke it a little bit up and down. And you'll feel the tenderness relieve as you massage that. So that's a really great pressure point that you can use at home and to help alleviate some of those symptoms previously mentioned. Spleen 6. The only contraindication is if you're pregnant, we can't use that point because it's actually strong enough to induce labor. The next point that I'm going to teach you to use at home is called stomach 36. Okay. Not only will it help with some skin conditions, but it also helps with some gastrointestinal discomfort, including nausea, vomiting. It also is a really powerful point for stress and fatigue. It helps pain, it helps depression, and it helps to improve your overall well-being. So very similar to spleen 6, stomach 36 is 4 finger widths from the bottom of your kneecap. Okay, so when you find the bottom of your kneecap, 4 finger widths down, you're going to find stomach 36. If you have a challenging time finding it, you can pump your knee up and down while you're sitting in your chair until you feel it pop out from your finger, okay? On the inside of your shin bone or your tibia. It's a very challenging point for me to show you because I have to stand on my chair and my chair wiggles and I don't want to fall off the chair today. The next point is called conception vessel 12. Okay, conception vessel 12 is in the midline of your body and it's halfway between your sternum or your breastbone, okay, and the belly button. So it's right in the middle between the breastbone and the belly button. And it's right in the middle. And it helps with any sort of upper digestive issues, such as heartburn, constipation, indigestion, stomach pain, and abdominal spasms. So when I'm in the office, what I do, I don't always use conception vessel acupuncture. I do a lot of releasing down this way on the patient's stomach to try and help with acid reflux, with hiatal hernia, or just discomfort with the stomach kind of sort of rising up into the thoracic area. Okay, so we have different cavities in our bodies. The thorax contains the heart and the lungs and the diaphragm, and then you have your abdominal cavity. Okay, so they're sort of separated by fascia or connective tissue, and you really don't want one cavity kind of coming up into the other because it creates a lot of upper digestive issues. So we actually use manual therapy to try and help sort of bring that tension down as much as we can. And conception vessel 12 is really effective. One of the things that we find with patients when they try to mimic that at home is that they find they just can't quite get at the angle as what we do when we're in the clinic, because we're able to come in on a 45-degree angle facing the patient. So I find it's easier for patients to just put pressure on the conception vessel acupressure point instead of trying to stimulate the abdominal cavity. Very, very effective point for upper gastrointestinal distress. This is one of my favorites. This one is called Kidney 3. And Kidney 3 is known in traditional Chinese medicine as the supreme stream, okay? It's a very, very tender point. And it is right behind the ankle bone, between the ankle bone and the Achilles tendon on the inside of the foot. And if anybody experiences any type of back pain, Kidney 3 is fantastic one for back pain, particularly when it's challenging to treat your own back. So very, very powerful. Here's the foot again. Here's the inside of the ankle. Here's the Achilles tendon, and there it is. So I feel the sensitivity or the irritation or the tenderness as soon as I apply a small amount of pressure. And it takes very, very little pressure in order to achieve a sensation that is quite tender, okay? Any of you that have heaviness in the joints, significant joint pain, decrease in energy, depression, anxiety, low energy, that is Kidney 3, okay? So Kidney 3 associated with spleen 6, so two of them very close together, are very, very good for scleroderma patients. And they're close enough that you can your foot and your hand are close enough, hopefully, that you can treat those areas yourself. The other one that I want to talk to you about is called Bladder 23. And Bladder 23, the bladder meridian runs on both sides of the back, about 2 inches from the spine on either side. Bladder 23 is a little bit challenging to locate, so I'm going to help you go through that during this demo. It's really great to help with the kidneys. So kidney 3 and bladder 23 tend to work hand in hand. It helps with all of your kidney function. So if you're having some difficulty with your urinary bladder or kidneys or any dysfunction there, bladder 23 is a really great one for you. It also helps with back pain, nourishes the blood, benefits bones and bone marrow, resolves that dampness sensation that you get with changes in weather, and it also helps with headaches and dizzinesses and balancing ears and eyes. So how do we find it? There's 2 points called the posterior superior iliac spine, and they're right above the belt line, and they're 2 little knobs or tubercles. Okay, you can feel them here. That's your L5. Okay, there's 5 vertebra in the low back. That's the 5th one. If you come underneath your rib cage, that is your first one, or T1. Okay. So bladder 23 is underneath the 2nd lumbar vertebra. So it's just 1 down from underneath the rib cage, or 3 up from the PSISs. Okay. Now, let's say you want to go see an acupuncturist and you live in Halifax. Well, we have an acupuncture school here, and I sent you the link that you can click on to access the school. It's on the Bedford Highway, and they do acupuncture. They do acupressure massage, which you just were taught 5 points. They also do ear acupuncture or auricular. And I have with me today some ear seeds, okay? And an ear seed looks like this. So there's a little bit of an adhesive, and underneath the adhesive, there's a little tiny black bearing. Some ear seeds actually have a little bit of like a sharper edge, like an acupuncture needle, but these here are just little black bearings. So what that acupuncturist would do would be finding a spot on the ear that correlates with the area that they're trying to achieve. And then they put the ear seed right in that particular area. And then the patient is instructed just to do some gentle pressure on that particular ball bearing or acupressure point throughout the day. And usually that adhesive will stay on for a couple weeks anyway, until you need to have them removed and have some new ones placed on. So the school provides acu or auricular ear acupuncture as well. They do herbal medicine, and they also do traditional Chinese medicine nutritional counseling. The price is $29.95 per session, and you would have that session done with one of the students. So if you were to go to a private clinic instead of the school, you would be paying anywhere between $75 and $150 a session, so about $100 a session. Each session is usually an hour to an hour and a half. And when you have your consultation with your acupuncturist, they'll take a full history, and then they'll do not only a physical exam, but also a traditional Chinese medicine exam too, and then come up with their treatment plan, at which time you would consent to, and then you would have your service done. I also included the hours that they're available too. So there's some weekend hours and some evening hours as well. So if that's something you might be interested in, you can hit the link to access the school's website. A lot of healthcare plans offer all of these services as well, up to a particular amount. So anywhere usually between $300 and $1,500 per calendar year. And oftentimes the insurance plans have a particular set amount per industry. So psychology, osteopath, physiotherapy, chiropractic, acupuncture, massage therapy. So all of those modalities are offered by professionals regulated in those industries at a particular price point. When I deal with persistent pain, chronic pain, autoimmune diseases, I tend to try and maximize the amount that their insurance covers over the calendar year. So we try and have people come periodically throughout the year so that their insurance can be maximized instead of coming in a short period of time. But that's why I also wanted to provide you with the school sites as well, just to give you another price point option. So we try really hard not to use everybody's health plan in a very short period of time. Chronic, persistent, and autoimmune diseases, we tend to try and space them out throughout the calendar year to make best use of their insurance plan. We're going to talk about massage therapy next. So massage therapy is an ancient form of pain management as well as stress relief. The Chinese practiced it for more than 3,000 years ago, and we've been using it since that time. And here in Canada, some provinces have it as a regulated healthcare profession, and others are working on making it regulatory. So there's different types of massage, and you and your massage therapist would work together to figure out what works best for you. So you can have effleurage, and that's more of a stroking type of massage, and it can be very light or it can be really firm. There's also compression. Some people would call that more sort of a sports massage where they get in on those beautiful tender points or trigger points. You can also have kneading, squeezing. People tend to use their elbows. Now there's some massages where they're actually standing on you with their feet. Percussion is another one that can be used as well. There's many different options out there. So you and your massage therapist would work on finding something that works really well for you. One of the things I wanted to do to show you was a little bit of the most current research to show what types of benefits massage therapy has on autoimmune and immune conditions that have been improved by massage therapy. So when we look at best research, we look at a type of research paper called randomized controlled trials, and they're our gold standard. They're the best research papers that we have. And so when we're looking at giving you the best advice, that's where we're looking when we're coming up with the best research. So these trials aren't particularly correlated with scleroderma in particular, but these are autoimmune conditions. And so even though it feels amazing to have your massage, and we talked about those items earlier about how manual therapy helps, just wanted to take a moment just to go over some of the research that we find when we're working on patients that have autoimmune or immune conditions. So with people such as asthma, we're seeing a forced expiratory flow increase. Multiple sclerosis, we've seen an increase in their function and balance. Anybody with HIV adults with depression, we saw a decrease in depression. Cancer in children and cancer in adults, we saw less pain and less anxiety, less vomiting, and less nausea. Breast cancer, we saw a decrease in sleep disturbance and an increase in immune function. And leukemia and cancer, we saw a decrease in stress and a decrease in pain. So these are very strong findings in not only how the massage helps with the physical symptoms that you're experiencing, but also some autonomic system changes as well. So what can you do at home if you want to treat yourself? There's lots of different tools and gadgets out there that can help mimic the symptom or this same type of treatment as the massage, you're not going to get quite that same effect, which we talked about earlier, because there is something therapeutic that happens in a treatment session when somebody is delivering the therapy to you, which was we talked about in slide 3. So this little thing here is called a Theragun, and it provides mechano as well as percussive techniques at an intensity that delivers quite a bit of force. So in other words, it's a massage device that people use, and there's very little force or pressure, but it provides really nice relief. There's lots of different price points available for gadgets like this, but they're highly effective, and a lot of us have them in the clinical settings as well to use. We have some massage schools here in Nova Scotia. This one is on the Mumford Road, and I sent a link here to their website. And I called them this week because their information wasn't on the website. So they have late afternoon and early evening appointments after the students are finished class for the day. If you have a massage with a second-year student, the cost is $40. Private clinics massages are usually anywhere between 35, 40, 60, or 90 minutes, and they usually range between $65 and $160. If you want a relaxation massage only, it's $30, and it's provided by the first-year students. So you call the number that I listed in bold, and you can make your appointment that way if you're interested in massage therapy. Now we're going to talk about chiropractic. Chiropractors treat the musculoskeletal system by adjusting the spine and other synovial joints. So that would be wrists, shoulders, knees, ankles, fingers, toes. Okay. Adjustments provide pain relief and an increase in range of motion. We use high velocity and low amplitude force to create the anatomical endpoint of the joint. Sometimes we get a popping sound, which is called a cavitation. But a lot of people think that that's all the chiropractor does. And so if they're a little bit anxious or nervous about that, they tend to not want to go see the chiropractor. But that's just one tool that the chiropractor has. They also look at health, stress reduction, exercise, diet. This tool here is a really nice, gentle tool that works on alleviating some of the pressure along the joints without any force at all. So some chiropractors have some variations of this too, where the force is going through the tissue without any movement at all. And a lot of patients can tolerate this technique much better. Or the chiropractor just does pressure points as well. Okay. So there's lots of different options that you can talk about with your chiropractor to help find something that works really, really well for you. The next couple slides talk a little bit about how the chiropractic adjustment works, but I'd like to move on a little bit quicker just in the matter of time, but I did put this there just so that you had a little bit of an idea from a physiological and a biomechanical view on how it works, but we're going to skip that today. And we're going to move into mindfulness-based interventions. And this is another area that I do in my clinic. I have a master's in sports psychology, and I use guided imagery or clinical hypnosis to help people with pain. But there's lots of different mindful-based interventions, including breathing, meditation, cognitive behavioral therapy, biofeedback, guided imagery, yoga, tai chi, and qigong are in there as well. And all of these activities help to increase self-awareness, relieve your stress, and improve interoception. And interoception refers to the representation of your internal world and includes the processes by which the organism senses, interprets, integrates, and regulates signals from within. So one of the things that the brain doesn't know is the difference between real and perceived. And so all we have is control over our thoughts. And oftentimes our thoughts aren't always positive. And so what we do is we use mindfulness-based interventions to help you change the way the brain perceives your thoughts in a positive way. You can also do some things at home like yoga, meditation, exercise, and even coloring. New research shows that it's a helpful adjunct in managing pain and other stress-related non-communicable diseases by fostering resilience through self-care. We also have some new research, very new research, showing that various neurological and physiological changes associated with mindfulness-based interventions, including activation of specific brain regions, increased heart rate variability, and suppression of stress-reduced inflammatory pathways. Mindfulness is not a panacea, but it is an evidence-based option for patients who are willing to explore a non-pharmacological option for pain management. So one of the things I'm going to do now is I'm going to do a guided relaxation session with all of you, and I'm going to do it in the next, it's going to be a little bit under 5 minutes, but I really want you to be able to get an idea or a demonstration of how it works in the clinical setting. So we take a full history, we find out some areas of concern, and then we come up with a guided relaxation session for you. And we want to relax the breathing, relax the body, and relax the mind. And we achieve that by talking to you in a way that allows the body and the mind and the breathing to relax. So we're going to take a couple minutes just so that I can do a little tiny bit on relaxing the breathing. That's as far as we'll get today. If we had a little bit more time, we would go through the relaxing of the body and the mind as well. So I invite everybody to either keep their eyes open or their eyes closed. And I want them to focus on their breathing, taking a nice breath in through their nose and out through their mouth. And breathe. Taking in beautiful oxygenated breath, bringing all that beautiful breath into every cell in the body, and release in through the nose and out through the mouth. Breathing in relaxation, breathing in peace, breathing in health, breathing in calmness, breathing out pain, breathing out worry, breathing out stress, breathing out anxiety, and breathe. Feeling the rise and fall of your diaphragm with each breath, feeling more and more relaxed with each breath, feeling more and more calm, more and more relaxed, and more centered. Breathing that breath into every cell in your body, and breathe. Knowing there's nowhere else you need to be, nothing else you need to do, but focus on your breath. And now I want you to notice any area of your body that you're suffering from pain, tightness, soreness, stress, worry, anxiety, fear. Send your breath to that area now and breathe. Watch the exchange of oxygenated and unoxygenated blood occur at that area. Sending all of your breath to that area. Watching that area improve with each breath. And relax. And now I want you to scan your body for any other areas of tension or pain or stress or anxiety or fear. focusing your breath at that area, and breathe. And now we're going to take a nice, deep cleansing breath in, filling our lungs, filling our diaphragm, and breathe it out. Taking another cleansing breath in and out. We're going to open our eyes now if our eyes are closed. And we're going to feel much more relaxed, much more calm, and much more at ease. So that's just a couple minute session of how we have the body start the relaxation process. And as you can see, it's highly effective. And our sessions are usually about an hour long. I record all of your sessions on your phone so that you can practice at home. And then that way you don't have to come into the office regularly. You can just do a lot of the work at home on your own. So once we get the breath relaxed, then we move more into relaxing the body, focusing on areas of pain, and doing a script that way. So each script takes about an hour. Okay, but then you have it at home. And the cost of those sessions are $150. And I just wanted to summarize with 2 more slides on nutrition. Now, I know you're going to have another session with dietitian or nutrition, but in my scope of practice, we do dietary and nutrition advice as well. And we, if you are going to ever take one supplement only, we highly recommend that you take an antioxidant supplement that has, we call it ACEs plus zinc. So vitamins A, C, E, B, then magnesium, calcium, zinc, and selenium. Okay. So what we know is that these vitamins and minerals provide antioxidant support and help with chronic diseases. Our ACEs, so ACE, selenium, and zinc, they're needed to regenerate, encourage detoxification, and prevent cellular damage. Okay, ACEs and zinc should be considered in cases of poor immunity. They help to ensure proper immune function and reduce the frequency of common infections, and they also help as an antiviral. But for you guys with scleroderma, they're very crucial in collagen production and for tissue healing. And they will help reduce irritation and improve healing. So when we do research on ACEs plus zinc, trauma such as surgery, bone fractures, open wounds, it helps with collagen synthesis and regenerates the skin, bone, and structural tissues. So if you're looking for any supplement to take, ACEs plus zinc would be the one, and it's only 1 per day. Okay. So it's 2:44. That concludes our session today on manual therapy. We wanted to be able to provide you with different price points to access care. We wanted to be able to provide you with some ways that you can treat yourself at home. And we wanted to give you just a little bit of an introduction on how people such as me help people such as you. And so now we're going to conclude by taking some questions that I can't wait to help answer.
Okay, great. Thanks, Kate. That was great. There was lots of great information, and I know Mary Ellen, I think, put into our chat the links that you had shared. I appreciate that too, in terms of the different options available to us, like the school in Bedford on the Bedford Highway. And so some of those options, as you've said, financially can be restraints to certainly to our community. So I appreciate those options that you posted or made available to us. So let's see what we have. I know I saw a question come up earlier, and I think it was about does air acupuncture help tendinitis, loss of balance.
Mhm. Yes. And the other one that you want to, the other one that helps is the kidney 3 will help with that too. Okay. So when you stimulate kidney 3, that will help as well. The spot that I'm going to get you to learn to massage too. If you come right underneath your earlobe, you'll feel a little protrusion of a particular vertebra, and that's called your C2. And your C2 vertebra will have a tender spot on it as well. And if you massage that or just hold the pressure point, that will help as well. Okay. So kidney 3 will be a powerful one. Plus C2 on the side of the ringing of the ears. Okay. So if it's the left side, you would do the left side. And then of course your auricular acupuncture will help as well. So yes.
Okay, cool. And with that, the ear seat that you spoke of, would that be something too? Yeah. Okay.
And there's different auricular points.
Okay.
Mhm.
Okay.
Oh. Why do we mess that up? Yes. Okay. I think I may have missed. Oh, here's the question. Why do we want to increase collagen synthesis when excess collagen has created our problems? I believe I may have misspoke on increasing the synthesis. What I sort of meant to say is it helps facilitate collagen synthesis in patients with scleroderma. Sorry about that. So if my slide was if my slide said I didn't mean to, I meant more facilitate facilitate collagen synthesis. Yeah. So my apologies to how I misspoke. Yeah. Thank you for pointing that out.
Yeah, I'm not surprised that someone probably picked up on that. I think it was in the chat too. Someone had, again, Kate, we have people from all over that join our webinars, and someone was said, I appreciate a referral recommendation of a massage therapist in Ottawa. So I don't know, in terms of your experience, the best way for people to look how to find a massage therapist or someone that, other tips and.
So every province has a list of registered therapists within their college. So for instance, one of the colleges here in Nova Scotia for massage therapy is called MTANS, Massage Therapy Association of Nova Scotia. So those people have their license through that particular college, and so you'll know that they're held to their particular standards. Yeah. Okay. So you want to make sure that your therapist that you choose is actually registered.
Okay.
Mm-hmm. And that's done provincially. So for the particular therapist in Ottawa, it would be under Ontario.
Okay. And I'm sure that I'm just thinking, I'm thinking out loud too. In terms of our conditions, I'm sure perhaps when you do that and you look for different therapies, there probably would list experiences perhaps of their clientele and what they maybe.
Well, websites and testimonials tend to go a long way, but oftentimes I'll have specific inquiries, and oftentimes I'll set some time aside to call the particular person back, and we can have a discussion to see if I'm the right fit for them based on their needs. So it's a great way to not completely commit, because you need to see if it's the right fit for you too. So oftentimes people will take your call and you can answer some specific questions. So you want to make sure that your therapist is the right fit, because previously discussed, that's so important in your therapeutic visit. Is it the right fit for me?
Right. Okay, that's good advice. And let's see what. Yeah, of course, someone that would be looking for experience in, she said, I'd like to have someone with, that had some experience with scleroderma and that,
So
so.
she can ask when she finds a particular clinic that she thinks might be the right fit. Absolutely, the question: do you treat this particular condition? Yeah.
Right,
Mhm.
yeah, yeah, that's good,
And we
excellent.
get those types of questions regularly. Yeah, for particular conditions. So
Right, of course. Okay. Do you personally do the meditation session for 150 for the hour that can be recorded to our phone for use at home? So as similar to, I guess that was, I think you said that though. Like
yeah.
yeah,
So part of that session is the recording, and
right.
historically, I used to do it and burn it on a CD in the olden days.
And the only
So everyone would go home with their CD. So
yes.
but now it wasn't that long ago, but it
Technology.
feels like a long time ago.
Absolutely, absolutely.
Yeah, so that's how I like to do it, and then that way
Yeah.
they don't have to continue to come back, and then they have a lifetime recording that they can do for home use. So really, I try to maximize as much as I can to empower the patient to do as much at home as possible and use me as an adjunct only. That's how I prefer to do things, because
Right.
empowerment is the key. Yeah.
Absolutely. Okay.
Mm-hmm.
Okay, Julie was just, thank you. And let's have another look. Open. So anonymous. Why do we? Okay. Are there any other clinics in the Maritimes, especially in Fredericton? Of course, and you indicate that. I think Charles was asking about other clinics available in the Maritimes, and so each province would have certainly would have like you said, a professional organization, and then there's clinics similar to your practices that exist all over the Maritimes.
Yes. Mm-hmm.
Yes. Okay. So again, I think as you've said, it's almost as an individual, I'd have to think of what services am I interested in looking for that I think could benefit me.
That's correct.
And then kind of making a list, and then doing some research in terms of just start looking
Mm-hmm.
and in your area and trying to get some testimonials, and then making some phone calls if there's important thing, like you would want to ask about their experience in terms of your disease.
That's correct.
Get some indication of costs and
Mm-hmm.
whatever is going to be important to making
Mm-hmm.
your decisions. Okay.
And we're an adjunct to your medical team, and where we do best is with pain and relaxation and your stress and your anxiety about, because manual therapy works best by down regulating pain and helping the relaxation response. And we never really used to know what type of benefit we were getting. And that's why the therapies that we provide in our clinic are specifically designed to target those complaints. Okay.
Right.
Yeah.
Right.
So with occupational therapy or physiotherapy, for instance, they're targeting the rehabilitation or exercise component, which is wonderful. And there's options for that. And I believe you're going to bring somebody on to help with that and assistive devices. I want to help you with your pain and your pain management, and help you be able to change the way that your brain perceives pain, and help you with having persistent pain and suffering. So the relaxation response as well as that. But we're not curing. We're adding as an adjunct to give you as much as we can so that you can help improve your current situation in whatever capacity that you're able to.
Okay. Excellent. All right.
Mm-hmm.
Okay. I think Judy was just looking for some additional information. I don't see any more questions at this time, Kate, which is fine. I think what I would like folks to know too is that this session is being recorded, and certainly we will send out the recording and the slides that Kate you had provided so that everyone can have those that information at home. So it will be posted on our Scleroderma website as well as our YouTube channel. So the recording will be available to be viewed again. Still don't have any questions, so I'm not going to, I think we can finish up. I certainly want to thank you, Kate, for taking your time on this Sunday and sharing your experience with us. And I myself, I love to be able to hear, but also take the information and do some practical, take the touch points and actually be able to do those at home. So I really appreciate having some takeaways from the session as well. So that's very important. So thank you very much for taking your time. Thank you to everyone that certainly joined us on this Sunday afternoon. I do see one more thing in the chat. Just a thank you again from folks that have been participating. So again, thanks everyone for joining us today, spending some time with us. Watch our social media platforms for upcoming webinars, and we hope to see you next month. Thanks very much.
Thank you.
Bye-bye.